Here's the presentation on Chapter 27, Common Porcine Diseases. Pig Diseases 101. For this chapter, you should be able to describe and recognize the clinical signs associated with the specific diseases that are presented, describe the cause of the diseases, describe the common treatments of these diseases, list the common and scientific names of parasites associated with pigs, and pigs do have a whole bunch of parasites associated with them, and list the common vaccinations and their schedules associated with pigs. And pigs have a lot of vaccinations that you need to be aware of. This is one of the better chapters, I think, in the diseases portion of this book, because they cover really a whole bunch of the major diseases of pigs. The ones you're going to see, the ones you're probably going to be tested on the VT&E, and the ones that are the most common and the most important. Having said that, I really hate pig diseases, but this is a good chapter. Start off with atropic rhinitis, which is caused by a bacteria you should be fairly familiar with, Bordetella bronchioseptica. In these pigs, you're going to see sneezing, coughing, tears, blockage, inflammation of the nasal or the nasolacrimal duct. They may have some epistaxis, decreased performance. They will eventually, if it's bad enough, have a deformity of the upper jaw. The atropic rhinitis is like a really bad cold, just awful. Clinical signs, necropsy, most of these guys present pretty easily. They've got atropic rhinitis. You're going to treat them with antibiotics. Vaccination's always a good idea. Temporary closure of the herd, better ventilation, going to specific pathogen-free stock, segregated early weaning. There's a whole bunch of things you can do. If they've got it, you've got to treat it with antibiotics and supportive care. The best way, of course, is to prevent it with vaccinations. Of course, everybody, it seems like on the farm, ends up with brucellosis. In this case, it's Brucella suis. And like most brucellosis, you're going to end up with abortion, orchitis, lameness, spondylitis, paralysis, metritis, abscesses, and temporary or permanent sterility. And this brucella is just really an awful thing in these guys. There is a card test for it. It's quick, it's easy, it's highly accurate. And if you've got brucellosis going in a herd, you've got real problems. Clostridium perfringens, type C enteritis. Yes, the pigs get their clostridiums too. Since clostridiums are primary soil dwellers, any place you're going to have animals out on soil, you're going to find clostridium. In this case, it's Clostridium perfringens, and it's going to be a necrohemorrhagic enteritis and hemorrhagic diarrhea. Nasty stuff, okay? Really nasty diarrhea, usually found at necropsy. Treatment is ineffective after clinical signs have developed. If they get this, there is a very high chance of their death. You do necropsy, send off tissue samples, comes back, you're going to find this for Clostridium. But again, with any Clostridium, there's probably going to be a pretty good vaccine for it. Enteric colibacillosis, caused by Escherichia coli. Our old friend E. coli shows up again, and they're going to have dehydration, acidosis, death. Very unhappy type of problem in these guys. Down there at the bottom, you can see on that far right, these pigs will get these really bad diarrheas. Culture, you can find culture, get enteric Escherichia coli out pretty easy. Know what you got. Most of these old pig farmers know immediately what this is. It has a characteristic diarrhea, has a unique kind of smell to it, and they can tell you they got colibacillosis from a mile away. If you get to them early, antibiotic therapy, fluids do a good job. And again, good supportive care very often in these piglets will really get things turned around. If they go very long or if it gets very entrenched in a herd, it's a real mess. Epithozoan suis, epithozoanosis, nasty stuff. Again, pigs get nasty diseases. They're none of their diseases are really all that pleasant. And this organism causes anemia, fever, pale mucous membranes, jaundice, as you would expect with a severe anemia, emaciation, staggering, paralysis, very weak neonates, unthrift appearances, well, like compared to all this other stuff, who cares what they look like, and reproductive failure. Giemsa stained peripheral blood smears will show the organism, E. suis, pretty quick. And if you can get to it early and get some tetracyclines in them, these guys will do real well. They do better than you'd think. So again, early diagnosis is essential. If it goes very long, your prognosis gets pretty poor. Staph hyacus, or exudative epidermitis. This is a pretty good skin infection of pigs. You see it more common than you'd think you would. The staph causes reddening of the skin, erosions of the coronary band, depression, anorexia, dark exudate. They have a picture there showing some of the clinical signs. This pretty typical staph infection of the skin, and you look at it and you say, yep, that's a staph infection of the skin. Goes on clinical signs. If you can catch it early, get antibiotics going on these guys. They do real well. And if it doesn't, then you can lose these guys to staph. Glasser disease. Glasser disease, not that common, but we see it. Haemophilus parasuus, Haemophilus parafluenzae, and Mycoplasma H. Multiple causative agents. And what you're going to find is there's going to be fever, depression, difficulty breathing, cough, anorexia, lameness. And remember, most pigs are housed, intensive housing. So especially the respiratory diseases can take off and really cause a lot of problems in these guys. History, clinical signs, cerebral spinal fluid, cardiac blood. There's several different ways to diagnose it. You're going to find if you ever work for a swine facility or anything else, if Glasser disease pops up, your veterinarian is going to have his own diagnostic protocol, and they are usually very accurate. If you can get to them early, again, like a lot of pig diseases with antibiotics, they're going to do well. If you let it go on too long, it's going to be a mess. Lepto, our old friend Lepto, shows up again. We all know about Lepto by now. All the Lepto names: Pomona, Canicola, Ectohemorrhagica, Gyptotryphosa. Clinical signs are SMEDI. Treat them, like most leptos, with chlortetracycline or oxytetracycline. Again, lepto, if you can get to it early, then you're going to have a pretty good outcome. I notice they're holding this little pig with gloves on, long arm gloves, probably a gown, a protective gown there. This can be really unpleasant disease, but again, if you get to it early, it's a pretty good thing. And if you have any problems, well, start to vaccinate. Mycoplasma pneumonia, caused by Mycoplasma hypopneumoniae, dry cough, decreased growth rates, poor feed efficiency, sporadic dyspnea, lung lesions. You don't really find this that much. You've got these coughing pigs and all that kind of stuff. Most of them do fine. If you treat them with antibiotics, especially, they'll do fine. Most of them will live no matter what you do. But a lot of times you'll go to the slaughterhouse, and that's where you find the lung lesions. There's can be some significant scarring of the lungs because of the Mycoplasma pneumonia. You don't want to get it going in your herd because you're going to find particularly decreased feed efficiency. They're just not going to thrive. They're not going to put on weight. They're not going to do well. It's not that they die from the disease. It's far more that it really runs them down. And if you're losing a lot of weight on these pigs, if you're not making, if you're 100 pounds at weaning weight and selling weight can make all the difference in the world, whether this is a profitable endeavor or whether you're going to lose money on it. So you really want to get this eliminated if you can. Pleuropneumonia. Again, we've got all these pigs concentrated together, so we've got lots of respiratory problems caused by Actinobacillus pleuropneumoniae. And as you would expect with an Lactobacillus pneumonia, you're going to have cyanosis, you're going to have thumps. I just love that word, thumps. open mouth breathing, oral discharge, frothy nasal discharge, anorexia, reluctance to move, fever, acute death can occur with this. Um, Severe upper respiratory and pneumonia signs. You're going to get clinical signs, history, necropsy, pretty typical on necropsy. If you can treat them early, you probably will save them, but it seems like this, once pleural pneumonia gets going in pigs, you're going to have just an endemic problem. So, depopulation may be the best resort if this really gets going. If you can get early segregation, weaning, and all in, all out at the same time, you can probably control it, but there are several different ways to can work with pleural pneumonia depending on when it's diagnosed. If it's 1 or 2 pigs, you get them out, you treat them with antibiotics, you sell them off, you don't let them back in the herd, you do all right. If it gets going in a herd, if it really gets to be endemic, then probably just depopulation, disinfection, starting over is your best way. Streptococcals, we do get some Streptococcus, Streptococcus suis and Streptococcus equisimilis. There's lots of different kinds of groups, Group D, Group C, Group L, Group E. You're going to find necropsy, culture, clinical signs, and you treat with antibiotics. And they have a picture down there of some tissue full of streps, and streps in pigs, not that common, but it's pretty nasty stuff. You just want to avoid the streps, particularly in the lungs. Once it gets down in the lungs, again, respiratory problems, you got mess. Swine dysentery, you'll see quite a bit about swine dysentery. It is a problem caused by a bacteria, Serpulinia H, I'm just going to say H. And it ends up, as you expect with a name like dysentery, it's going to be a disease that causes dysentery, diarrhea. Anorexia, diarrhea, dehydration, weakness, gaunt appearance, fever. A lot of these guys, with pigs, you're seeing like it's diarrhea, respiratory, diarrhea, respiratory, diarrhea, respiratory. There are some fairly good serological tests that can be done to really definitively diagnose this. The book talks about clinical signs. Necropsy is fairly non-specific on necropsy, but you can do some ELISA tests or some other things, and you get some pretty good results. Antibiotics management usually will work wonders. Again, once it gets endemic in a herd, you may just need to sell off, start fresh. Erysipelas, often referred to as diamond skin disease, swine erysipelas, caused by Erysipelathrix rudiocephathae. And they're going to have fever, lameness, lack of milk production, abortion, skin discolorations, death. Erysipelas is usually diagnosed either, again, clinically or by necropsy or by serological testing. You can treat it. You can treat swine erysipelas. In large herds, it's not particularly effective. If it's like backyard breeders who's got 4, 5, 6 pigs, yeah, you can treat it. Have a hope of having some success with treatment, getting rid of it, doing okay. If it's in a huge farrowing facility or feeding facility, you're going to have big problems with swine erysipelas. It's called diamond skin disease because in one form it causes disruptions of the skin vasculature, and it will form a clot there, and then when the skin there dies, it forms a skin necrosis pattern, diamond shaped. Hog cholera, one of the most dreaded of all diseases, and hog cholera just gets going. It's a viral disease, and once it gets going, it's really messy. It is just awful. You end up with poor reproductive performance. It has a neurological form, fever, decreased appetite, constipation, depression, and again, virus isolation and petechial hemorrhages. Hog cholera is not one of those that's going to have a high mortality, but it has a high morbidity. And it gets going in a herd, and all these pigs are sick, and they stay sick, and they don't do very well. They don't reproduce. They don't feed well. They're a mess. There's all kinds, because it is so contagious. It's so easily spread from herd to herd to herd. There are virological tests, antigen detection, nucleic acid detection, serological testing. If hog cholera shows up, what you got to do is most of the time just herd slaughter. and disinfect and hope that when you reintroduce pigs, nothing ever gets it again. Vaccination, I'm not a big fan of vaccination for hog cholera. I think it just needs to be, you just need to be covered, and it just needs to be, all these pigs need to be eliminated and start fresh. Porcine parvovirus, again, not particularly a diarrhea virus in pigs, but it caused mummification of fetuses, abortions, stillbirths. There is a good fluorescent antibody test for it. The good news is you can vaccinate for it. Down there is a picture showing a sow that has aborted all these mummified fetuses. Porcine parvovirus, if it gets going in a facility, if they're not vaccinated, if they're susceptible to it, can cause these abortion storms. And they're just really disgusting once they get going. Once it gets in the pig, well, there's no going back. Porcine reproductive and respiratory syndrome, PRRS, another virus. Clinical signs: SMEDI, anorexia, agalactia, not making no milk, thumps, pneumonia, reproductive and respiratory syndrome. It's going to hit them both reproductively as well as, bless their little hearts, they're going to get bad respiratory signs. Treatments, there is none. This is, again, a cull and kill and then start over thing. Although I've heard some people say that they've ridden it out and everything was okay, but I don't really believe it. Pseudorabies, often referred to as Olszewski disease. It's an enveloped DNA in the herpes family. Clinical signs of pseudorabies is tremors, paddling, anorexia, fever, respiratory disease, fluorescent antibody testing to diagnose it. You can also use virus isolation, serological testing. There's lots of ways to chase it down. It's called pseudorabies because, quote unquote, it shows some signs of rabies, but it's not really rabies. It is a reportable disease. It has to be reported, has to be turned in. Pseudorabies does not want to get going. And if it is found, it has to be properly diagnosed and it has to be reported. And then you're going to have to decide what you want to do. Usually it's kill and cull. Swine influenza, boy, you hear a lot about swine influenza and people and all that kind of stuff. It's another virus of the influenza A group. And when they get it, they're going to have fever, depression, difficulty breathing, anorexia, mucus discharge of the eyes and nose. A lot of what we look like when we get influenza, only we don't have as much upper respiratory probably. And it's clinical signs, virus isolation. You really do need to definitively diagnose it. You can often end up with secondary bacterial infections with these guys, and they get into pneumonias and they get really sick. Supportive, if you wanted to give supportive care to them, if it's a large herd, it's going to be very, very difficult to give supportive care to 50,000 pigs. If it's a small backyard guy or people, that's a different story. Swine influenza. TGE, transmissible gastroenteritis, it's coronavirus. As you would expect, it has gastroenteritis types of signs: vomiting, diarrhea, dehydration. TGE gets going, it can really get nasty in a herd because you got 35,000 pigs that are all having TGE, all having vomiting and diarrhea. Not a pleasant place to be. It's usually diagnosed with clinical signs. Also, there's serological testing that can be done. If they get caught early and there is good supportive care, good management, it can be taken care of. If not, you're going to have a fairly significant mortality with these guys, almost always from dehydration. Anemia, pigs get anemia, remarkably so. What causes anemia? In their case is low iron. Okay, so pigs really need to have iron supplements. And when you have anemia, you're going to have difficulty breathing. You don't have enough red cells to carry oxygen. You're going to have a rough hair coat. They're going to look terrible. They're going to have poor growth. They're just going to, in the main thing, they're just anemic. Okay, they're just going to be anemic. There aren't that many blood-sucking intestinal parasites in pigs. So if you find pigs that are really anemic on a consistent basis, it's probably going to be dietary in nature. People often feed backyard pigs the most ridiculous, absurd things you can imagine. That's always a great adventure. If you ever work in a place where you're messing with pigs, ask people, what are you feeding your pigs, especially pet pigs. And you'd be amazed at the stuff. You think people come up with some weird stuff for dogs? You ain't seen nothing till you find out some of the things that they feed their pigs. And again, it's because there's somebody online, Dr. Google, or at the feed store that knows more than we do. And of course, if you just simply treat them with iron supplements, either orally or by injection, amazing, they start to develop red blood cells and they're all better. No, we don't want to feed them an all cabbage diet. Malignant hyperthermia, MH. Boy, I love my MH. And if you've been around through my classes long enough, you'll understand MH is one of my favorite phenomena in all of anesthesia. You're going to find malignant hyperthermia most commonly happens in people and in pigs. And in fact, in studying MH in humans, we use pigs as our animal model. When it's triggered by anesthetics, almost always either by inhalants, and I always thought halothane was the worst, or by neuromuscular blocking agents, and of those succinylcholine is the worst. And what happens is the muscle cells appear to have an impaired ability to regulate calcium flowing in and out of the cell, and they end up going into an extremely high temperature. Malignant hyperthermia and PSS, their temperatures just go through the roof. Now, admittedly, we're not doing probably that much succinylcholine and halothane or inhalants in pigs, but it can occur. Here's your big thing. You need to know what the reversal agent or the treatment for it is, and that's dantrolene. You always have, if you work around, either MH occurs in dogs as well, occasionally pops up there. Having a bottle of dantrolene on the shelf somewhere probably isn't a bad idea. Because you're not going to have it very often, and it's expensive as the dickens, but if you don't, these guys are going to die. They just are going to die. So, if you work in a surgery center somewhere, human surgery center, I guarantee you there's a bottle of dantrolene around somewhere. Parakeratosis causes rough, scaly skin, pretty easy to diagnose. Again, deficiency of zinc, in this case zinc, is going to be a dietary deficiency. And if you can balance a good commercial diet where zinc and calcium are balanced so that one doesn't pull the other out of the urinary system and into the urine, you're going to do just fine. But again, pig people with their weird pig diets sometimes just don't do well. That's why balanced commercial diets are the way to go. Prolapse, we end up with vaginal, rectal, and uterine prolapse. In this case, uterine prolapses, and in pigs, this is pretty well a death sentence. They just don't do well after these. Rickets, our old friend rickets, again, lack of calcium, phosphorus, or vitamin D in the diet, or imbalances in calcium and phosphorus. They'll end up with slow grow rates, crooked legs. Balance the diet. Okay, again, go back to a good commercial diet and you'll do just fine. Be sure and go through and study your vaccinations for this chapter, and be sure and go through and look at the parasites associated with pigs. There's lots and lots and lots of pig parasites. You should have already been through those in some of your other classes, particularly in clinical pathology, but it's worth the review. And that finishes up pig diseases. And what we want is a bunch of happy, healthy, precocious, funny little pigs. They really are pretty cute.